Hi there. So I wanted to spend a little bit of time sharing some of the interesting work we've been doing at our clinic on lens-based postural therapy. This is employing the use of lenses to affect a change in how a person is processing spatial information through the two eyes. So the brain is marrying the information cortically and processing information about relative space between the two comparative images. And remember, when an eye is um, receiving information, it's not a flat image on a flat screen, that the eyeball is a curved surface. It's not just a little snapshot in the center of the vision, but rather an array of information coming in, and that the brain is comparing those images between the two in order to process depth. And a person's sense of depth and space has an immediate impact on their use of their body, their posture, how they stand, how freely they move. And I have been uncovering this with explorations with patients. This is not something that we learn in optometry school, but I've fallen into doing this as a mode of helping some patients who have a tendency for one eye to cyclodeviate. So a very small pivotal change of one eye relative to the other can add all sorts of additional strain cranially, and as the patient is trying to resolve that, they may do things like subtle head postures and tilts that help support the body movement, um, keeping the eyes in alignment because binocular vision is such a priority. But at the same time, it creates some interferences, possibly at the neck, and then muscle differences that go all along the entire spinal chain. I myself ended up working out a set of lenses for myself and found in the middle of a class recently that my own head movement is completely different when I wear these posturally supportive lenses compared to taking them off. So if I'm just giving a range of motion of my neck as I turn my head side to side, you can see that if I take my glasses off, my range gets actually more limited. It's tightened on both sides. So if I pull my head as far as I can, I get a strain over here to the right. And then when the lens is on, I have an easy extra 10 degrees that I can turn before I feel any sort of resistance. If I take my glasses off, if I turn here and then I add the lenses, I have another maybe 12 to 15 degrees. I can actually get my chin back to my shoulder. And so there's a total difference in how my body is organizing movement when the lenses are in place or they're not.